So this is the last part where we will be mainly covering about the ear, little bit of introduction to ear anatomy, and then the guidelines. Now the next topic is ear, where we'll be talking little bit about the ear anatomy. And again, as I said, that when you start a topic, just take a minute to go through all the topic, and you will understand that the codes are divided depending upon the external ear, middle ear, and inner ear. So let's begin. So let us look at the human ear, which is the organ responsible for both hearing and the balance. It is divided into three main parts: the outer ear, middle ear, and the inner ear, each playing the distinct role in the sound. So let us look at the outer ear. So if you see the outer ear, it is mainly this part which is visible outside, and it is made up of the skin and the cartilage that helps to collect the sound waves and tunnel them into the ear. And then we talk about the external auditory meatus. It is a tube-like passage that carries sound waves to the eardrum. So this is the external auditory meatus. And then we call it as a tympanic membrane. The tympanic membrane is a thin stretch membrane that vibrates when sound waves hit and separate the outer and the middle ear. So this is all about the outer ear. Now let us turn to the middle ear. The middle ear, it is important because it mainly consists of the three tiny bones that amplify the sound vibration from the eardrum and transmit them to the inner ear. Now these three bones are important because they repeatedly ask this: what are the ossicles of the of the ear or the olfactory system? And you will see that these three ossicles which are there, they are called as the malleus, incus, and steps, and the name is derived because of their shape. And then we talk about the eustachian tube. The eustachian tube is the tube that connects the middle ear to the back of the throat, and it helps to equalize the air pressure. And so whenever during the cough and cold this tube gets blocked, you do get a ear pain, or you do get a vertigo like sensation, because there is a imbalance in the air pressure. And then the inner ear, it mainly consists of the cochlea. Cochlea is a snail shaped organ. It is fluid filled structure containing the cells and convert the sound vibration into the electrical signal. And then auditory nerve, which transmit the electrical signal from the cochlea to the brain, where they are interpreted as a sound. And then we have this three semicircular canal, three fluid filled loops that helps with the balance and spatial orientation. So these are the important parts of the ear, and one must know them well, because these they ask in the anatomy section. So if you look at the code range, it is also divided into the surgical procedure on the external ear, middle ear, and the inner ear. So let's begin with the external ear. It mainly includes the incision, excision, removal, and repair procedure. So like you will have the simple drainage versus the complicated drainage, and even the removal of the cerumen. Cerumen is nothing but the ear wax, and when you are removing it, either you use the simple irrigation or the lavage method, or sometimes you have to use the instrumentation to remove the impacted cerumen. So depending upon that, we will use the code. And if uh, these codes are mainly used for the unilateral procedure. So when we are using bilaterally, we will have to put the modifier 50. Also consider the using of the modifier LT and RT in case the procedure is carried out unilaterally, in order to specify the laterality, that unilaterally but on which side. For that we will use the modifier LT and RT. So the next important topic is the the codes related to the middle ear, and in that I would like to explain the concept of myringotomy and tympanostomy. Myringotomy involves the making a small incision in the eardrum for drainage. So if you see this particular diagram here, we have given the small incision, and so that whatever the pus accumulation that has happened in the middle ear, it get drained out through the tympanic membrane. While the tympanostomy, it is usually done whenever there is a repeated infection in the patient. So what we do is we not only do the incision, but we put the vestibular tube here, so that this area remains open, and if the patient is having repeated infection due to this ventilation tube, there will be continuous drainage, and then the patient won't have the otitis media, like the serious or the chronic otitis media. This is usually given for the chronic otitis media. Then the anesthesia, that is also one of the important consideration, because some of these procedures are carried out under the anesthesia, and some are given under the local anesthesia. So use of the local and general anesthesia is important consideration for the code selection, because we have a separate code for that. And then many time what we do is we use the operating microscope. Now, whether to write the operating microscope code separately or it is included in that, for that we need to read the parenthetical note and the code language, and of course look at the operating microscope code, which is 69990. Below that there is a big code range is given, and if your code falls into that category, then there is no need to write that code. And the last codes are mainly for the medical services related to the inner ear. Now, in this case, there are codes which involve the incision and dissection within the inner ear, such as performed for the condition like Meniere's disease. Then there are codes which refers to the excision of the tissue within the inner ear, which mainly include the labyrinthectomy, where we remove the labyrinth. So the labyrinth is basically, if you're seeing this bony labyrinth, and in that you will have this a membranous labyrinth, and we remove that, especially in the Meniere's disease. And then we also cover the implantation of the cochlear device, prosthetic device that provides hearing to individual with the complete hearing loss, or more than 70% of the hearing loss. So let us take the example. A 4-year-old with a chronic otitis media and fluid buildup in both the ears was admitted by her otolaryngologist for a bilateral tympanostomy. The procedure was performed with the placement of the ventilating tube, and the procedure required general anesthesia due to the patient's age. So select the procedure code for this procedure. So what the important point that we can collect from here, that see, if you look at the option, you will see that all the code requires a modifier 50. That means the procedure has to be carried out bilaterally, and we are getting that it is a bilateral tympanostomy. And let us look at the code options. The 69420, it talks about the myringotomy, and 421 also talks about the myringotomy. And we know the difference, that myringotomy is nothing but the incision into the tympanic membrane, while that of a tympanostomy, where we not only incise the the tympanic membrane, but we put the the ventilating tube. And so we cannot use this two code because it talks about the tympanostomy. So 69433 and 436, these are the two code which we will consider. Now in between that, we need to zero down one code. So what is that one sentence that will zero down your code, that you tell me. So yes, D is the correct answer, because if you see both the code, one is tympanostomy requiring insertion of the ventilating tube, but it is carried out under local anesthesia. And if the tympanostomy with the ventilating tube is carried out under general anesthesia, we have a code 69436. And since it is done bilaterally, we need to put the modifier 50, and that's what exactly happened in our case. Let us take one more example. This is the operative report. Remember, now you get 10 operative report. This is where the preoperative diagnosis is bilateral serous otitis media, and the postoperative diagnosis remains the same. See, whenever you have the operative report, most of your time goes in reading. So what you need to read is the operative technique, because there you will get lot of information about the procedure. So the patient has a history of persistent serous otitis media, unimproved with aggressive antibiotic therapy over past 6 months, with recurrent acute otitis and failure on maintenance antibiotic. The patient was brought to the operation room, given a general anesthetic by mask. The ear canal were inspected. The tympanostomy incision was made in the interior inferior quadrant in the radial incision. A small amount of serous fluid was found in the middle ear space on both the side. An Armstrong grommet ventilation tube was placed in both the ears with alligator forceps and suction clear. Tobradex drops were placed through the PE tube in each ear. The patient was sent to the recovery room in good condition, discharged with Tobradex drop prescription for 2 days. So what has happened here is a tympanostomy that has happened, and it has happened under general anesthesia. So that should be your main focus. So look at the code and tell me the answer. So this is a case of tympanostomy, not a tympanoplasty. And if you look at the code 69631 and 641, they are the tympanoplasty, and we have done the stomy. So we will concentrate on two code, and that is 69433 and 436. And if you see, these are the code for the tympanostomy, and the code differs whether the procedure is done under general anesthesia or no. And we can already see here that the patient was given a general anesthetic by mask, and then the patient was sent to the recovery room. This is enough for us to zero down the code, which includes the general anesthesia. So let us take the next question. A 2-year-old arrives at the emergency department crying and tugging and holding her ear. After the examination, the physician determined there is a small plastic toy piece lodged in the external auditory canal and removes it using small forceps. What is the procedure code for the service? So what has happened is there is a foreign body that has been lodged into external auditory canal, and they have removed it. And so let us look at the option 105 is biopsy external auditory canal. That definitely didn't happen. 69110 excision external ear partial simple repair. So here at this point you should know the difference between the external ear and auditory canal. So external ear is the pinna part, while the auditory canal is the canal which leads to the tympanic membrane, and there the foreign body is lodged. So you have 200 and 205. Tell me what is the correct option. So yes, 69200 is the correct option, because here the anesthesia is not given. So the patient must have given the topical anesthesia, because the general anesthesia is not mentioned, and the foreign body has been removed from the external auditory canal. So the next question is, a 6-year-old female with a prominent ears undergoes the bilateral autoplasty. Under conscious sedation, the surgeon makes an incision just behind the ear in the natural fold where an ear is joined to the head, exposing the cartilage. Cartilage is trimmed and shaped, and the incision is closed. Temporary sutures are placed to secure the ear until healing is accomplished. The procedure repeated on the other ear. What CPT code is reported? So what has happened here is the autoplasty. Autoplasty means reshaping. So if you can see, the ear is protruding out and it has been reshaped. So let us look at the code 69300 is autoplasty protruding ear with or without size reduction. That is one code. 310 is reconstruction of the external auditory canal. So remember, it is the external ear, not the canal. And that's for the example stenosis due to injury and infection. And 69120 is a complete amputation for reconstruction of the ear. Now, after going through all this code, you know that which is the right code. But just remember that this autoplasty has been done bilaterally. So we need to find out what is the correct option. Yes, B is the correct option, because below 69300 it is written that if it is done bilaterally, then we need to put a modifier 50, and that's why we will go with the option B. So, infant who has a chronic otitis media in the right and the left ear was placed under general anesthesia and radial incision was made in the posterior quadrant of the left and the right tympanic membrane. A large amount of the mucodiffusion was suctioned and then the ventilating tube was placed in both the ears. What CPT and ICD codes are reported? So what has happened is they have put the ventilating tube into the tympanic membrane. So this is the case of a tympanostomy, not myringotomy. Myringotomy is basically cutting the tympanic membrane and allowing the pus to drain. But here they have put the tube so that the in future also if there is a pus collection, that will continue to drain. So that is one important consideration. And then the second important consideration is this procedure has been carried out under general anesthesia. So these are the two data points which we have found out. So kindly read the code and tell me the answer. So yes, A is the correct answer because it is a tympanostomy requiring the ventilating tube and under the general anesthesia, and it is carried out bilaterally. So we will have to put a modifier 50. That parenthetical note you will definitely see under all the codes. And then 865.33, this is the ICD code which talks about chronic mucoid otitis media bilateral, and that's why is the correct answer. Now, the operative report, they have become the big, the important part of all the CPC exams. So one must know uh, how to go with the operative report. Now, in this case, the operative diagnosis is bilateral impacted ventilating tube, and the procedure is removal and replacement of the new tube bilaterally via tympanostomy. And the procedure is Sammy, the 16-year-old patient, was admitted and taken to the operative suite and placed under the general anesthesia by inhalation. When adequate sedation was achieved, 3.8 millimeter speculum was inserted into the left ear, wax removed and speculum removed. The impacted tube was then removed. A new site was achieved within the same tympanosclerosis plaque and the new took place. The same procedure was repeated for the right ear. Sammy was sent to the recovery room suite in stable condition. So what has happened is the previous tympanostomy or the ventilating tube was removed and then replaced. So let us look at the code, and they have done this bilaterally because bilateral impacted ventilating tube. And here also they have removed, the same procedure was repeated to the right ear. So these are the important data points. Now let us look at the code. 424, it talks about ventilating tube removal requiring the general anesthesia. And 436 is the tympanostomy requiring insertion of the ventilating tube, general anesthesia. 433 is the local anesthesia. Now in this case the anesthesia is general. So we will require a code 436. So the option B is not the correct answer, and even option D because it also has the code 433, and we have just seen the 433 talks about local anesthesia. So remember, B and D is not the correct answer. Now in between A and C, tell me what is the correct answer. So the answer is C, and here there is a very important guideline. Sadly, it is not yet given. It isn't given in the CPT book, but you do not code separately for the removal of the ventilating tube if you are replacing with the new tube at the same session. Only the insertion code is reported. This is a very important guideline. I have taken this question specifically so that I can tell you this guideline, or we can again revise this guideline. The next question is 43-year-old patient who suffers from severe intermittent vertigo has been definitely diagnosed with Meniere's disease. After a year of various treatment, medication, test and behavioral lifestyle changes, that have failed to laser the symptoms, she now present for the transcanal chemical labyrinthotomy to the right ear. Dr. Millers visualized the tympanic membrane with an operating microscope, cleans the ear canal and makes a small incision into tympanic membrane. Gentamicin is delivered into the right ear. The patient is repositioned with the right ear up and monitored by the nurses. The perfusion is repeated to achieve the maximum result. The ear is suctioned, cleaned, and carefully examined for the bleeding. The patient tolerated the procedure well and is returned to the recovery area in satisfactory condition. How would Dr. Millet report his professional service? So what has happened here is the labyrinthotomy has happened, and by putting the drugs, gentamicin has been used, and that has been put, and they have also used the operating microscope. So let us look at our code. Now, if you see the code, the first code 69801, it talks about labyrinthotomy, while the 69905, it talks about labyrinthectomy. Now, I mean, if you read the spelling in a hurry, you might end up reading both the spelling same. But there is a bit of a difference. Labyrinthotomy is a surgical procedure that involves creating an opening into the labyrinth, while ectomy is surgical procedure that involves the removal or destruction of the labyrinth. What here that has happened is labyrinthotomy. Okay, and then remember, do not report 69801 more than once per day, and do not report 69801 in conjunction with this code when performed on the same year. So these are the important parenthetical note. Now you have all this important clue. Tell me what is the answer. So yes, C is the correct answer, because H81.01 talks about the Meniere's disease, the right eye. Well, that of a H81.09 is talks about unspecified ear. But in our patient, we very well know that it is the right ear. Then 69801, it talks about a labyrinthotomy with a perfusion of the vestibulo active drug, which is the gentamicin in this case. And of course, we will have to use the 69990. It is a code for the operating microscope, and it has been there in our patient. So by looking at all those codes, we can zero down the option C. So this is the last slide of the nervous system, and we have finished the nervous system, that is the 60,000 series, and soon we'll start with the 70,000, that is a radiology.